Good evening. They could be exposed to the coronavirus every time they go on a call. Nashville firefighters want more coronavirus testing inside their fire hall.
Some tell News Channel 5 investigates the department is reluctant to test because it's worried about having too many firefighters off of work. Investigative reporter Ben Hall found more than 150 firefighters have missed work because of the virus, and overtime costs are soaring.
You have to treat every call as a possible COVID patient.
It is the new reality. Every call could expose first responders to COVID-19, but exposure can also come from fellow workers.
If you're showing symptoms, you will be tested only with symptoms.
Union President Mark Young is concerned the Nashville Fire Department only tests firefighters when they have symptoms, not when they come in direct contact with a fellow firefighter or patient who is tested positive. The fire department says 30 members have been infected with COVID-19 so far, and as of early this week, 19 firefighters were on quarantine.
If we know we have a positive employee and we know we have direct contact, I think the direct contacts ought to be tested.
But the department is sticking by its policy, first released in a March memo, which states firefighters will not be tested for COVID-19 if they are symptom-free. It means a firefighter could find out he has COVID-19 after working a shift or more with fellow firefighters in a fire hall. But those he came in contact with in that fire hall are not automatically tested.
I can promise you, Ben, they're in very close, contact with one another all the time.
Councilman at Large Steve Glover said Metro should protect firefighters the way it attempts to protect the public and use the same rules that it uses for businesses.
Anytime somebody in a restaurant tests positive, they make the restaurant close down. Take your own medicine. If that's what you're prescribing, live by it.
The fire department says its policy follows CDC guidelines, which are specific for healthcare providers. The department said, "Our safety office does not consider time in the fire station as close contact." Some firefighters feel the department does not want them to test because Metro is worried about large numbers of firefighters missing work. The fire department says 168 employees have missed work since early April because of the virus. Many were quarantined, which has dramatically increased overtime costs. The department says overtime expenses through May of this year are more than $1.5 million higher than at the same time last year. That is not all COVID. It also includes tornado costs and work during the downtown protests.
All we ever do is pretend like everything's okay with our fire department, our police department. It's not okay. We don't have enough people in those departments.
Glover says the overtime reveals the department is understaffed. He says $1.5 million could have been used to hire more firefighters for the department.
We spend all this money on overtime when if we budgeted properly, then we could cut the overtime down and actually give greater support in those departments.
Metro Fire Chief William Swan declined an on-camera interview but said in a statement, "We continue to update our COVID-19 protocols." The Metro Finance Department said it expects to get federal money, either from FEMA or through the CARES Act, to cover much of the overtime expenses. Ben Hall, News Channel 5 investigates.